the Vice Chair of Quality, Patient Safety, and Equity at Baylor College of Medicine. She earned her bachelor's degree in chemical engineering from Howard University and her medical degree from the University of Texas Medical School at Houston. Her training includes a residency in OBGYN at St. Joseph's Hospital in Houston, followed by a fellowship in MFM at the University of Texas Medical School in Houston. Dr. Davidson joined the Baylor College of Medicine in 2007 and works at Ben Taub Hospital and Texas Children's Pavilion for Women in the Texas Medical Center. She served as the chief of OBGYN at Ben Taub from 2011 to 2016 and is now the vice chair of quality and patient safety in the Department of OBGYN at Baylor College of Medicine, as well as the chief quality officer at Texas Children's Hospital. She's the co-chair of the obstetrics subcommittee at TCHMB and also the vice chair of the SMFM Patient Safety and Quality Committee. Her areas of interest include learner education, medical complications of pregnancy, VBAC, and healthcare disparities and equity. Dr. Davidson, I'm handing off to you.
Thank you, Dr. Savani, and I just want to confirm maybe with a thumbs up that you can hear me.
Yes, we can.
Okay, excellent. Well, thank you. I am very excited to moderate this portion of the summit. But before I begin, I just want to say also a very personal thank you to Dr. Bingham for that outstanding talk. I have personally done the Speak Up training that she offers, and it was fantastic. And I use her Maze of Life in many of my talks. So thank you so much for the work. I've also participated in the 28-day anti-racism challenge. Her organization has so many outstanding resources. So thank you for being here with us today. And I want to turn the session, kind of switch gears a little bit to hear from our patients, because we've talked so much about the impact of what we do on our patients. And we are very fortunate to have 4 families with us today to share their experiences during the birth process and after delivery as well. And I think this is just always a very well received part of any conference I've ever been to, because it is so important to hear exactly how they perceive the care they're receiving. And so I'm going to introduce each one of them now. They're all going to share their story for about 15 minutes. And then after that, we will go into a 15-minute Q&A. So we'll save all of the questions for the end, but please feel free to put them in the chat as we go along so that we have them all already together by the time we get to the end of the talk. So our first patient representative is Judith Osborne. She works at MD Anderson Cancer Center within the Health Information Management Department. She pursued a degree in health service management so that she could assist patients in getting the best out of their health care. Judith has 2 children, an 11-year-old daughter and a 1-year-old son. Judith had preeclampsia and gestational diabetes with both of her pregnancies, and she is still dealing with some complications from her last pregnancy. After Judith, we will hear from Harish Iyer and Shobana Natarajan. Harish is a computer engineer with an MBA, and Shobana has a PhD in molecular genetics and is a medical communication specialist. However, they have given themselves their own titles of CPO, or Chief Paternal Officer, and CMO, or Chief Maternal Officer, of the Iyer household. In that role, they are parents to resilient, compassionate, and creative 14-year-old Sahana Iyer. Sahana was born at 24 weeks and spent her first 7.5 months in the hospital before going home with a tracheostomy, G-tube, and ventilator. After them, we will hear from Kate Principe. Kate Principe is a certified genetic counselor and the regional genetics coordinator for the Gulf Coast with Texas Oncology. She has practiced in the field of hereditary cancer for 9 years. Her professional and research interests include access and service delivery models for genetic counseling, testing, and improving rates of appropriate genetic testing in the community oncology setting. After a postpartum complication in 2020 during the pandemic, Kate became passionate about maternal health care, especially postpartum care. She completed the Mama's Voices Patient Family Partner training in 2021 and has shared her story on a variety of platforms. And finally, we're going to hear from Stacey and Eric Brown. They are the parents of 5 and an ambassador family for the March of Dimes. In that role, Stacey and Eric share their story to spread awareness surrounding premature births. Stacey gave birth to premature triplets born at 28 weeks and 5 days gestation. They live in College Station with their 5 children. So now I'm going to hand it over to Judith to share her story.
Hi, everyone. Thank you so much. I am delighted to be here to share my story with everyone, not just my story, my experience, and hopefully it can make a change. I have 2 children. My oldest is 11-year-old. She's a girl. And when I was pregnant with her, I was living in Maryland at the time, so they're 2 different states. That I was pregnant in and had 2 different experiences. With my daughter, I had preeclampsia and also gestational diabetes, and it wasn't as bad as with my son, who's now 1. Most of what I've learned with being pregnant with my son was what I have gained experience with being pregnant with my daughter. With my son, everything was going fine. I thought I'd beat the odds with him until when I first found out that there was little signs and symptoms that I was feeling and seeing. But I wasn't dismissing them because I would talk to the doctor and it wasn't much of a big deal to her. She just said, okay, I'll keep my eye on you, per se. And the stuff that I was told was normal ended up being not normal, like unable to walk certain distance without being out of breath, and the swelling that I was told was normal, especially with my son. When I found out that I had gestational diabetes, I was well educated. I felt like I could be a dietitian by the time I was done with all the information that I was receiving. I was receiving classes and pamphlets and educational items. But when it comes to the preeclampsia, I wasn't well educated on it. Majority of the things that I knew was with my daughter, and that was my first pregnancy. So all of that was more so like, okay, I can handle this. Like, I did it once, I can do this again. But I didn't realize the severity of the danger that I was in. I wasn't educated during my pregnancy of that danger. When I ended up in a hospital, because I went to one of my hospital visits, and the doctor told me, she said, okay, you have to go over to the emergency room. The doctor's office was basically kind of like across the street from the hospital. And when I went over there, they monitored me and did my finger stick and realized that my glucose level was way too high. So I started to be on diabetes medication, injections. Again, at this time, I was introduced to a dietitian. Still nothing about the preeclampsia. When I got discharged, I came home and I was more so focusing on the diabetes part of it, trying to make sure that I'm eating right and I'm walking after eating, try to stay healthy, but I couldn't so much because the preeclampsia was kind of like knocking me down because I couldn't walk too much of a distance without getting the shortness of breath and without my limbs swelling up. So around seven months pregnant, I started going to the doctors more frequently, and she said, okay, you have to monitor your blood pressure at home. I'm going home, I'm monitoring my blood pressure. And again, I'm still thinking, oh, I can handle this. You know, like I've been there before, I've done this before, I can handle this. But I didn't do much of a research then on the preeclampsia because I thought I knew what I knew. Ended up going to the doctor's office, and she said to me, I was doing one of my visits, and she said, okay, we got to go back over to the emergency room. Your blood pressure is way too high. And at that time, I'm like, okay, I'll just go over there to just have me lay down and I'll just relax. And then that would be it. To my knowledge, I went there and they had to transfer me to another hospital. And when I went to that hospital, the only thing that I was told, I had the urine test done. And at that time is when I realized, okay, this is a little bit more serious, because now I'm not going to get to go home. They told me, they said, okay, you cannot go home. We have to admit you until when you have the baby. The sad part about this is it was during the pandemic and I was doing it by myself. My fiance could not be there because of COVID. So I feel like all of this, I was literally going through it on my own. They were, every single day, they were coming into the house, to the room, and they was taking panels and tests and stuff. And afterwards, I found out that my organs were shutting down because of the preeclampsia. I just feel like as if the ball was dropped on my care, because it was way more than what I know. It was, and after I had my son, I didn't even get to bond with him. They took him away from me. They brought him to the Nicu. He stayed into the Nicu for a whole entire month. After he was released from the NICU is when we found out that they kept him way far. They kept him longer than they should have. Because of the gestational diabetes, he had to have, I think, sugar and water, they call it. And after that, he was fine. He was eating, but he was a little picky eater. And they kept him there for a whole month, which that added on to depression. While I was visiting him, I was feeling this headache that you get with the preeclampsia. So I went up to the emergency room and I said to the doctor, I said, I had baby here a few weeks, and I'm still going through, I'm feeling things that I was feeling when I was pregnant. I'm still feeling tired. I'm still feeling this headache that is beyond anything that I felt before, not even when I was pregnant with my daughter. All they did was they had me lay down, they checked my blood pressure and released me with blood pressure medicine on top of the blood pressure medicine that I was already taking, and that was it. No one tells me or told me that preeclampsia is not done with you once you had a baby. Once you have a baby, it still can linger. Today, from my pregnancy, I'm now diabetic. I still have moments where my blood pressure was spiked. So I'm still having to take blood pressure medication. The depression is not so much. What got me through that was knowing that I was able to breastfeed our son, knowing that, you know, there's still things that I can do for him. The NICU, it's good, but it can be devastating. It can be devastating. There were things that occurs there that it's just, I don't think people take into consideration the family so much, and what we're going through, especially, you know, you just had a baby, and the deal is you bring your baby home with you, you know, and we had to leave him there and we had to visit him, and him being there longer than he should have. It's just the whole, while still dealing with preeclampsia. It was a horrible, horrible experience. And if we all can learn from this and take from this and try to make it better for the family, I am the voice of the female and babies that passed away that did not get the chance to speak. I am the voice of women who's going through this right now, who families going through this, who husband and boyfriend and fiance is looking at their girlfriends or wives and wondering what is wrong with them. There's a lot of things that we take for normal and we hear, oh, that is normal, but it's not normal at all. And I just, the ball that is being dropped on us being pregnant and the things that we are normalizing and not letting us know that this is really what's happening, is devastating, and it's causing a lot of female and babies to die from it. And I'm grateful to have this opportunity to be the voice of those who can no longer speak.
Thank you so much, Judith, for sharing. And I know we have some comments about your story and some questions that we'll get to at the end. But again, thank you so much for sharing your experiences with us. And now we're going to move on to hear from Harish and Shobana.
Hi, everyone. Thank you very much for the opportunity to speak here. I think Dr. Davidson did a great job introducing us at the beginning, but just to remind you, our daughter Sahana Iyer was born back in 2007. She's 14 years old today. And, you know, I can totally relate to some of the sentiments that Judith has spoken about, even though our experience was so long ago, it still remains so fresh in our hearts. I went through in vitro fertilization, and about 6 months after that, Sahana decided to show up, actually about 5.5 months, which is 24 weeks. A couple of weeks before she was born, I just had a premonition and decided to resign from my job to take it easy for the 3rd trimester. And it's still a sore spot for me that I never got to have a 3rd trimester. I actually went to the OBGYN 3 days in a row, the day after Christmas in 2007, 26th, 27th, and 28th. 26th was a regular scheduled appointment with my OBGYN. Everything looked great. We even had a conversation about Plano Presby being a level 3 NICU. And you know, he assured us that we're not going to need a NICU. He said, it's going to be a healthy pregnancy, not to worry. The following day, the 27th of December, I was back in the office with some discomfort and pain, but it was charted out to be pain due to a growing fetus. But on 27th night, I started spiking a fever of 101, had some bloody urine and spotting, called the doctor that night. And he said, if it gets worse, to go to the ER, otherwise to see him back in his office in the morning. I don't think I slept that night. I was so scared that I didn't want to go to the ER, but maybe I should have. But the next day, we were back in the OBGYN's office with the fever and bloody urine. He said he sent me to Plano Presby to be under observation, which was okay. I was still hoping to finish the shopping that I had planned for the rest of that day and that weekend. It was a Friday. But by the time I checked in at Plano Presby, my water broke, and I was admitted and very soon figured out that the baby was going to come out that day. So we had very little time. We were told about getting steroid shots to strengthen the lungs, etc. But Sahana just didn't have enough time for the lungs to get better. We were admitted at about 11:30 in the morning, and Sahana made her arrival at about 4:30 in the evening that day. The rest of it is a blur. Between Jan and April of 2008, she was on the ventilator with nasogastric and orogastric tube feeds. She was quite spunky and had multiple accidental and planned extubations, which eventually led to her having subclottic stenosis. Fortunately, she had some very small brain bleeds, which resolved pretty well. Fortunately, there were no infections, although we had many scares, many calls in the middle of the night. 4 months into this, we had made friends with several families in the NICU going through what we thought was a similar path to us. But by about April or May, all of them had been discharged and made their way home, while Sahana could not be extubated. We went through the painful process of talking to a pulmonologist and deciding to do a cricoid split to try to expand her upper airway. That actually put her over the edge, and her lungs collapsed, and she was on a high frequency ventilator for, I don't know, about a week.
A couple of days.
Right. Do you want to take over?
Yeah, so I mean, the journey through the NICU was obviously quite long, and we went through a cricoid split. She was on a high frequency ventilator, and for me as a parent, kind of, I would spend pretty much as much of my waking hours as possible at bedside. Maybe much to the consternation of a lot of the nurses and the therapists, because here was dad always in the way. Kind of thing, but hey, that was my way of being at peace, I think, with just the entire journey, if you will. We were trying our best to basically avoid any more intrusive procedures and any more intrusive, I guess, devices or appliances being placed in her, right? And I think kudos to the Plano Presby team of neonatologists, nurses, therapists, and so on, for really being really patient with us in hearing us out and listening to our concerns and trying to work with us while all the time putting the baby's best interests first and foremost, right? So somewhere around the April-May timeframe in 2008, after we'd gone through the cricoid split, we continued to attempt extubations, continued to try to put her on, progressively stepping her down through CPAP and nasal cannulas and oxygen levels and so on. I think we reluctantly came to the conclusion that our path out of the NICU, unfortunately, would involve a tracheostomy, right? So sometime in June, we came to the conclusion that that had to be done. And so in June, she got a trach. Later in June, early July, came the gastrotomy or the G-tube. So we kind of began to see that as a path home. Obviously, at that stage, neither of us was really prepared to be able to care for a child with a trach and a G-tube at home, as much as we thought we could, and we wanted to come home because, again, like the previous parent said, we were expecting to go home with the baby after about 3 days. I mean, in that sense, we were already 6 months behind schedule, right? Of course, little did we know that, even today we don't get to dictate schedule. Sahana does, right? So we don't. And so sometime in July, we decided, after a great deal of discussion, some due diligence, site reviews, and so on, we decided to make the transition from the NICU to our children's house, which at that time was under Baylor management, I believe. Excuse me. And it was run by Dr. Gelfand, who was our pulmonologist at that point, right? So we went to OCH, and in hindsight, that was probably our best decision to really have done it. And that really helped wean Sahana down and get her stable enough to a point where she could, in fact, come home, albeit on a ventilator with 24-hour nursing, right? But most importantly, I think it gave Shobana and me the confidence to be able to care for her by ourselves if we had to, because again, as those of you in the profession know, home health nursing is not completely reliable. While we were able to get most, if not all, of our shifts covered, there was always situations when the nurse would not show up, and or they were not adequately trained, or they were just not efficient. In fact, we had a couple of nurses that basically were sleeping at home, in our home, on night shift, right? So imagine that. Of course, we fired them immediately, and basically we resumed taking care of our baby that night, right? So I think that was basically the transition from the NICU to OCH. We spent 5 weeks there. We transitioned home from OCH and brought her home. This was in August of 2008. She came home on a ventilator. We still remember the day as though it was just yesterday, right? And the amount of planning and the thought process. And I think as you probably caught during the introductions, I'm an engineer by basic education. I have an MBA. I'm a supply chain professional. So I help companies with organizing and managing and planning their supply chain. So kind of thinking very analytically and making a plan for everything is very intrinsic to what Shobna and I do every day. And so even today, when I go back and look at a 5-page document that we created, she and I created, that would basically almost down to the minute plan what we would have to do to manage that journey, the transport from OCH to a nursing home and then on to home, right? Just down to the minute, because there were that many breathing treatments, that many feeds, those many moving parts that had to be all managed just for that one transport, in effect. So Shobna, you want to pick up from the weaning off the ventilator piece?
Right. So yeah, Sahana came home, bells and whistles. It was, raining constantly. The roads were flooded. The ambulance that brought her home wouldn't drive on flooded roads. We didn't know if we were going to make it home that night or had to go back to a nursing home, which was even worse than being in a NICU or in the OCH. But we were glad we made it home. She came home at 1:30 in the morning on August 20th, 2008. And then she was stable enough to be home. We had our challenges in getting her settled at home. But over the next 3 or 4 months, we slowly weaned her off the ventilator, which was a huge relief. We were outpatient at Dr. Gelfan's vent clinic, as many of you must know. She still had her subglottic stenosis, due to which the trach had to stay in place. And we started seeing another ENT specialist to figure out next steps. About 6 months later, in 2009, in the summer, she had a couple of laser surgeries to clear the scar and expand her airway, which for a change worked in her favor. Until now, every decision was, we were told at every point that there's a 95% chance of success, but a 5% chance that it's not going to work in your favor. Finally, we had things working in our favor with these laser surgeries. Within a month, we capped her trach, and we had intense OTPT and speech therapy until then, and all of that really came into play and showed how much it had helped. Her speech was effectively unaffected. The day we capped her trach, she talked nonstop for 3 hours. And then, the journey continued with reversing her tracheostomy and reversing her gastrostomy. I can't believe it to this day that I actually was able to go back to work and have a career.
Yeah, so just in terms of timelines, I mean, the trach basically came out in April 2010. So in effect, she'd had a trach for roughly 2 years.
Hi, I'm Sahana Iyer. I am a 14-year-old middle schooler in Coppell, Texas. I'd like to thank all the nurses and doctors who have helped me throughout my life. Some of my interests and hobbies include story writing, singing, and experimenting in the kitchen. I enjoy creative writing and choir in school, as well as biology. Since a young age, I've always been interested in anything medical related, with my favorite TV show being Untold Stories of the ER. This year, I've combined my love for biology and creative writing with my stories, a restaurant called Blastocyst Brunch, and Sugar, Spice, and Staphylococcus aureus, along with many others in my book, which is available on Amazon. I've also got a recipe blog where you can learn how to make your own human blastocysts and staff-topped cupcakes. Also, feel free to check out my YouTube channel where I post covers sometimes. Thank you.
Well, what a treat. Thank you so much for sharing that video, and thanks Sahana for preparing that for us so that we could hear directly from her. And thank you so much for sharing your story. I know there are a lot of comments and emotions, and we are going to take questions again at the very end, but next we will move on to Kate and hear her story.
Thank you, Dr. Davidson. My name is Kate Principe, and I'm going to be sharing my postpartum pre-eclampsia story with you all today. So we found out that we were expecting back in November of 2019. I had a normal pregnancy. Obviously, like hindsight is 2020. We all know what's coming, but I had a very normal pregnancy other than being a genetic counselor. So like, I know way too much about all the things that can go wrong. And then, you know, kind of when the pandemic hit, I was considered low risk. And so was converted to virtual visits for the majority of my third trimester. I was seen in person at about 28 weeks and then not again until 35 weeks. My blood pressure at home had been normal, but when I went in for my 35-week appointment, it was markedly elevated. We chalked it up to white coat hypertension, but did decide to go ahead and do a 24-hour urine, which came back with elevated proteins. We continued to monitor my blood pressure at home, and kind of over the next couple of days, it slowly crept up into that higher risk range and made the decision to induce at 37 weeks. My labor and delivery was completely uneventful. We had been told to prepare for, you know, first baby, multiple day induction. We're going to be there for a long time. 10 hours of Pitocin and 2 contractions worth of pushing, and we had a baby. During kind of right after my daughter was born, my blood pressure went back to normal. But during my stay, it did start to kind of creep up a little bit again. We felt comfortable with doing home monitoring, but my OB had really prepared me for the possibility of postpartum preeclampsia. She stressed multiple times that this can happen to about 10% or so of women, and that if my blood pressure hit a certain point or if I started having certain symptoms, she would want to readmit me to receive magnesium. Our first evening home, I started to notice some strange symptoms that didn't quite fit with what I was expecting for postpartum. The first thing that I noticed was that I was having involuntary like muscle movements, which I've never seen as like an official symptom of postpartum preeclampsia, but in hearing other moms' stories, it seems like that's a common symptom that many people experience. I also experienced some episodes of tunnel vision overnight and honestly chalked it up to like, I had a baby, I'm exhausted. That's probably why all of a sudden my vision is blacking out. The whole next day, I kind of just felt like I'd been hit by a truck. But again, like chalked it up to, I had a baby 3 days ago. Of course, I feel terrible. Like I have expected to feel terrible. A human exited my body. And I honestly didn't really have time to like sit around and think about those symptoms. We had to take our daughter to her first pediatrician appointment where we learned that her bilirubin was critically high and they were starting to talk about NICU admission for her if we couldn't get it down. So we were very focused on her needs, not my needs. As the day progressed, I started to continue to have additional symptoms. The next symptom that presented itself was what I now know is upper right quadrant pain. I just kept complaining about like, you know, my ribs really hurt, but it's only on the right side. I'm not sure what's going on with that. I probably just pulled something while I was in labor. And then I started having heart palpitations and could just feel my heart beating very intensely. And that's when I was like, okay, I probably need to take my blood pressure. I had honestly been putting it off. I think because I deep down inside knew that something was wrong and that I was looking at hospital readmission. And I just didn't want to go back into the hospital in June 2020. So I finally took it at about 9:30. It's of course in the like, go to the ER urgently range. And I called the on-call nurse. She told me to go to the ER as soon as possible. And I immediately started bargaining with my husband to not take me. And I think for maybe the third time in our entire relationship, he started crying and said, "Oh, excuse me, I cannot raise this child by myself. You have to go to the ER." And only because of that did I agree to go. I went to the ER that was in the same hospital that I delivered in, figuring that I'm in the same institution, same medical record system, like this should be easy. Because it was June 2020, because of the COVID situation, no one was allowed to come into the ER with me. So I had to navigate, much like Judith, I had to navigate that experience by myself. I followed every instruction that my discharge nurse had given me when I left labor and delivery. I gave my name, my date of birth, my OB's name, all of my symptoms, my prenatal diagnosis of preeclampsia, and I repeated this to every single person who walked in the room. I repeated this to the billing person before she could get out, that she was there to collect a copay. While I was in the ER, my symptoms continued to get worse. I was starting to have now like involuntary head movements. Every time my heart would beat, my head would jerk, just because of how much force, just because of how high my blood pressure was. While I was in the ER, I was provided very little information as to what was going on, despite my attempts to ask questions and to advocate for myself. When I asked what medication was being pushed through my IV, the nurse responded, "Something for your blood pressure," and left before I could ask anything else. When a number of people showed up to take a chest x-ray, I asked, "Okay, why am I having a chest x-ray?" And the only response I got was, "Well, it's for your heart." My memories of the ER are very fuzzy, admittedly, and some of that is trauma response, and some of that is because I felt so terrible. Finally, the ER physician came in and told me that she wanted to work me up for cardiomyopathy. She said that they'd called the on-call OB, and the on-call OB had said to just send me home and follow up with cardio in the morning. The ER doctor did offer to admit me for observation, and the one thing that I vividly remember her saying was, "You probably just need an Ambien and a night away from your newborn." My two thoughts were, if I die, my husband cannot be the one who has to deal with my body, and I really need a breast pump because my milk just came in. So I agreed to be admitted. I found myself on a cardiac floor. I repeated my speech again to every single person that walked in the room. My blood pressure was only being monitored every couple of hours, and it continued to be very high, even on multiple medications. That's when I learned that my liver enzymes were elevated, which is another indication of issues with preeclampsia, as we're all aware of. I started experiencing a pounding headache. I was starting to swell, and I had no supplies to care for the second-degree tear that I had sustained during my vaginal delivery. I had no one who had knowledge of lactation medications, and so I had to dump all of the colostrum that I was pumping because we didn't know if it would be safe to give my newborn. At 7 a.m. shift change, I begged my new nurse to call my OB directly. I gave her all the information that she needed to call my OB directly, and was brushed off. I was told that an internist will see you in the morning. No one gave me any information again about, plan of care, medications, labs that were being drawn, all of these things. One of the only things that I really remember this nurse saying was, "You should probably just go ahead and order dinner because you're going to be here for a while with that blood pressure." And it was at that point that I knew, okay, I have to take this into my own hands. I very much considered leaving AMA at that point and just walking over to my OB's office, but I honestly knew I would not physically make it that far. So as soon as their office opened, I called and left a message with the nurse. My OB called me directly within 5 minutes. She told me that, I never should have been readmitted, I never should have been readmitted to the cardiac floor or internal medicine floor or wherever I had ended up, and that I should have gone straight to labor and delivery. And she immediately started the process of transferring me to labor and delivery, as well as obtaining the appropriate authorizations for my husband and newborn to enter the hospital. That morning, the hospital had stopped allowing visitors to enter because of the spike in COVID cases that was being observed. So I finally made it onto L&D at about 11 a.m. So it was about 13 hours after I had walked through the ER doors and started receiving magnesium. I cannot say enough things about the nurses that I interacted with in labor and delivery, both like as a laboring mom and postpartum, but also, with this experience. Everyone was so kind and gentle, and I was in shock. And then we added magnesium to it. And they explained magnesium like, you'll feel like you have the flu, but that's a lie. It feels a lot worse than the flu. And, the floor manager did everything that she could to make sure that my husband and daughter could re-enter the hospital. She was throwing verbal elbows at people, to make sure that they could get through the doors during the COVID lockdown. I was released after about a 24-hour infusion of magnesium. I continued to take antihypertensive medication for a couple weeks. My blood pressure did eventually go back to normal. As a healthcare provider, I knew that what I had experienced was not right. And I decided to file a complaint with the hospital about the situation. I was informed via letter that an investigation had been completed and that I just didn't advocate well enough for myself while I was in the ER. After I got this letter, I started having intense flashbacks. When I would lay down at night, I was back in the ER. I lost all confidence in my abilities to seek medical care, and that's something that I'm still struggling with and working through. I started suffering what I now know was very intense postpartum depression, as well as PTSD. But I just didn't have the energy to navigate a system that had let me down on so many levels. And so it took me about 6 to 7 months to finally get that diagnosis from a reproductive psychiatrist. Since that point, I've done a lot of work to kind of get to a point where I can look back at that story or look back at that situation and not immediately feel like I'm back in the ER. I've reviewed the documentation from that night with my OB and have gotten conflicting information. And that's honestly been something that's really hard for me to kind of reconcile. I've heard everything about this situation was wrong to, well, we were just trying to keep people out of the hospital because of COVID. I've heard, magnesium should have been started immediately, and well, you weren't really in like real danger. I've heard, they weren't following, the on-call doctor wasn't following protocol, and I mean, I would trust them in an emergency. And it's hard to feel gaslit by a provider that I really want to trust. We're at the point now where we feel confident that we want to have another baby and we want to start trying soon, but I feel like I have to make a really impossible decision about, do I stay with the beast I know or do I switch to a beast I don't? And there's no right answer, and I'm the only one that can make that decision. Thank you so much for listening and hearing all of the patient stories presented here today. And I look forward to answering questions in a couple minutes.
Wow, Kate, I'm a little speechless after that. And thank you again so much for sharing that story. We are going to move on to our last family, and then we'll take questions and answers afterwards. So again, please put your Q&A in the chat. And I'm going to hand it over to Stacey and Eric Brown now.
You're muted.
I also apologize that you couldn't hear a thing I just said. So let me try that again.
If my husband and I were in the same place, he would not have let that happen. He's the technology man. So my name is Stacey Brown. This is my husband, Eric Brown. As you have already heard, we are parents of 5 from College Station, Texas. In hearing these ladies' stories, I realize how incredibly blessed that we were to have had the care that we had during all of our pregnancies. While there is always another side, we overall were very blessed. My first pregnancy was a 14-year-old, now 14-year-old daughter, was a textbook pregnancy, absolutely all the way. Between my daughter and my son, who is now 10 years old, I suffered a miscarriage at 9 weeks and went on just a little bit later to have my son, who's now 10. Went to a regular OBGYN appointment not long after, well, about 6 years after, excuse me, triplets are trying to come in and say hello, and found out, surprise, you are having triplets. So we now have 4-year-old daughters as well. We had a very, I almost would say, easy pregnancy with the triplets. My OBGYN told me from the very beginning of my pregnancy, you know, you are high risk. This will end in a C-section. I can send you to a specialist, but he felt confident in his abilities to manage a multiple pregnancy, and knowing his history and his track record, I felt confident in that as well. Like I said, as far as my pregnancy went, it was very uneventful until it wasn't, and then it was over. I had gestational diabetes with my son, who is now 10, had just been diagnosed with gestational diabetes with the triplets. Went into a regular doctor's appointment at about 28 weeks. It was a Wednesday. My doctor did all the normal things, said everything looks good, but now, Stacey, I am going to be out of town, so I need you to behave yourself. And at that point, I was already measuring 41 weeks at just 28. And I said, I can't do anything but sit in a recliner. So don't you worry, everything will be fine. 2 days later, on Friday, of course, he was already out of town, I woke up with some severe back pain. And went into labor and delivery, just knowing something was not quite right. Eventually, we would find out that there was a kidney infection that pushed my body into labor, and they were not able to stop it here at our local hospital, and I was actually life-flighted to a larger medical center 90 miles away. And so I was life-flighted on that Sunday following, just 2 days after I had been admitted here. And within 12 hours, the OBGYN on duty there came in and said, we've tried everything. They've tried everything. You can either continue to suffer and we can continue to do the interventions we're doing, which are not helping, or we can have babies. At that point, I had been on magnesium for 2 days, which, as the previous presenter said, is way worse than the flu. My husband can speak to some of the hallucinations that I was having. We joke now because I was convinced that we were in Australia, apparently, and there were toucans and kangaroos all over my room. I had been unable to even keep down ice chips for 2 days. And my husband can tell you he honestly did not think that I or the babies was going to come home with him at that point. I had, on that Friday when I went into the hospital, thankfully the doctors had the forethought to go ahead and give us the steroid shots. So the girls had those for their lung development. We were very blessed. But we got to the hospital after the life flight on Sunday, and they were born just within 12 hours. And I'm going to let my husband tell you a little bit more about the girls' condition, because I was so out of it at that point. I don't remember a lot.
So when they were born, one of the kind of funny things beginning. This was the same OB that had delivered our first two. He had told us that, oh, y'all have had big babies, and so that will actually help you out whenever they're born. And all three of the girls weighed over 3 pounds. And remember, even the NICU nurses being like, how far along were they? And we're like 28 weeks, 5 days. And they were 3 pounds, 3 ounces, 3 pounds, and 3 pounds, 2 ounces. And so they were just kind of, wow, that's a lot of baby in a tiny person. Stacey's only 5 feet tall. So they're like I said, there wasn't a lot of room. As far as care, with the first one, she was born, everything was good. They got her cleaned up and into the incubator. With the second one, there were a few things to get her going, and she took a little bit longer to get going. And just the nurse that was there handling that situation was what I needed that prompt as an exhausted dad who had been awake for 3 days trying to figure out what's going on, had to chase the helicopter speed down the highway, chasing the helicopter to be there whenever she arrived at the hospital. And so kind of figured out from that point that we were in a very good place. And the girls ended up being in the NICU for 5 days there before the first one was discharged. And then we transferred the other two back home to College Station. While there, the care they received, the medical care they received was phenomenal. And we had been told that they were in a good hospital, and we saw that day in out. But the thing that I was more impressed of as a father and a husband was they really made an effort to focus on whole family care. Anytime we brought our big children on weekends to come visit, the NICU nurses now we could all visit. This was pre-COVID, and we had 3 children in the NICU, so we were able to bring both of the bigs in at time. But the nurses on duty always made the effort to say, okay, this is what's going on with your brother, with your sisters right now. If they were there during when it's time to do vitals or change their diaper, they would let them be involved and just would really make the effort to connect with them. And then also with me, same thing. I was still working during this time and taking care of the older two in College Station while she was living in another town with the so that she could go to the hospital every day. We were very, very fortunate to have that. We were able to do that situation. And during the week, however, I would take one day off during the week to come down without the big children. And we had a nurse who was one of our primary night nurses, and she knew that I would come down every Tuesday. And so she would call me and say, hey, are you going to be here by this time, or did you get held up in traffic? And I said, no, I'm on pace to be here at this time. And she's like, okay, well, it's almost time for their 9 o'clock feeding and things, so I can wait till like 9, 10 till you can get up here so that you can do it all. And so just really the level of care that they received and that they offered for us. Along with that, being at a bigger hospital, there was a child life specialist who provided a lot of resources with us as far as, again, for our big older children. Hey, this is what's going on your sisters right now. They're okay. This is what you'll see. Don't be afraid. Yes, there's all these tubes and wires hooked up to them, but it's to help them. And then as we were getting closer to discharge, they offered, okay, it's flu season right now. I'm a school teacher, and the big kids are in school. So this is what you need to do when you get home before you go touch those babies, because their immune systems are still not going to be fully developed, and you don't want to risk anything. And so this is what you need to do to make formula. This is what you need. So just even though we had been parents of 2 that had just parenting, we did learn that parenting a NICU baby continues to be a whole different experience, especially when there are 3 of them. And even unfortunately, learning sometimes the disparity between, we don't necessarily live in a rural area, but the quality and level of care between big cities and small cities, because that was whenever one got, as I said earlier, one of the triplets was discharged early, and so we got the other two transferred back home so we could be all together again. And even the first night there, I called Stacey and was like, this is like night and day, so we need to be here as much as we can so that we can help. At this point, the two that were still in the NICU were feeders and growers. They just, they wanted to grow. They just didn't want to put forth the effort to feed to grow. And so we tried to be there, the two of us, with them being there. She would be day shift and I would go at night because we wanted to try to just facilitate them to eat so that they could come home.
And I will say that we did have to advocate quite a bit more once we got here. It kind of cut out on my feed, so I don't know if you guys got or not, but our first triplet was discharged after 55 days. So the other two ended up being discharged on day 73 of their NICU time. But once we got here, the two who were still in the hospital, like Eric said, they wanted to grow, but they did not want to do the eating part. And it was very, very different. At the larger hospital, we had a lot of therapy support that was coming in, feeding therapists showing us all the tricks for feeding a NICU baby. Once we got here, the neonatologist took a very different approach and said, they'll eat when they eat. It'll be okay. We'll tube feed them until they learn to eat. The one kind of like, thing that I remember being said to me, well, there's a couple, but one of the kind of like, maybe you should have rethought what you just said there, things that I remember being said to me in the NICU was, well, we've never had a bus pick up for kindergarten from here. And I remember thinking, ow, thanks, but no, that was not helpful in this moment. The other, just really quickly, the other comment that was made that hurt me the most as a new mom was made actually at a different hospital regarding breastfeeding. I've never been a milk producer with my older two children, did not produce real well with the triplets, but did everything that I could and got every milliliter that I could. But one of the NICU nurses basically told me that I should be doing a better job of pumping, and it was my fault. And that is like a stab to the heart when you are a postpartum mom with 3 babies in the NICU, living 90 miles away from the rest of your family in a complete stranger's home. But that aside, after we took care of that situation, the care was amazing. But we did learn a lot about advocating at that point, which gave Eric and I both a different perspective. Eric is a special education teacher, and I was a general ed teacher in a special education classroom. So we learned what it's like to be on the other side of the table for the parents that we usually work with. Sorry, took over for you, Hun. Go ahead.
No, you're good. So yeah, just really, I guess if I could tell you one thing, what I would like if we had to have children again, probably the most positive thing was once they knew that the medical care was down, that they really did make an effort to focus on the whole family. And especially as we got to know them more, because they knew this had started out as a stressful, very traumatic experience. She was helicoptered down there. I drove down there. We were separated, living in 2 different towns for 2 months. And so I guess it's one of those things is you don't ever know everybody's story. So just always, I know it's hard. It can be hard to ask questions, but if they share just even a listening ear for 2 minutes or even 5 minutes, if you ask a parent in the NICU how they're doing or what's going on, just, they may pour out to you, but I can tell you again, for me as a dad, that was one of the good things is I felt that a lot of the personnel there always genuinely cared. They wanted to know it's not like, I'm a dad, they knew we had 3 babies, a traumatic start. So they just really made effort for whole family care.
And even in our situation, we actually different perspective in that we got to know the administrators at both hospitals because we had them lobbying behind our backs, essentially. At one point, we didn't even know all the conversations that were going on to try to get our 2 babies transferred so that we could all be together as a family. And the transport director at the hospital, the CEO of the hospital, 2 different hospitals. In fact, I had cell phone numbers for 2 CEOs at one point, and could call them with concerns about care and things like that. So I do, like I said, I do realize that we were incredibly blessed in many areas of our experience.
Well, thank you so much, Stacey and Eric, for sharing. And we have about 10 minutes for questions and answers. And so everyone's going to come back. All of our patient representatives are going to come back on camera now. If you don't mind, I'll kick it off because I think it's interesting. We heard from 2 of you who had experiences during the pandemic and 2 who didn't. And many of you described very different NICU experiences. And Eric, I love the way you described the term whole family care and how you had the child life specialist and how they really seemed to be connected with you and your family. You also described your ability, you and Stacey's ability to be at the hospital almost kind of, around the clock. So I just wonder from your experiences, were there certain things that made you connect more with one team versus the other? And what advice might you be able to give for new parents who, now during the pandemic may not have that ability to spend as much time, or for parents who just aren't able to get up there as often? Do you have any words of wisdom for how they can better connect?
Well, I know one of the things that, like we say, we advocate for March Time. So I know one of the things that they've been working on is like iPads and all that I've seen as well. Our hospital experience again was just amazing because we had an awesome day crew and we had an awesome night crew, and we got to know all of them. Even with me just going there once a week, got to know some of the day crew, or just because of the rotation, would see them on weekends. I would say just getting for the parents to get there, connect, make a friend with the nurse. Or one of the things we figured out is as we got to know some of these nurses, when I wasn't there during the week and she would be home in the evening, they would call me every night. Like I know they would call me at 8 o'clock or 11 o'clock or 9 and midnight. I was like, I don't care especially, when we're in the first couple of weeks, I was like, please call me with their vitals and their updates. And so I would say just really try to understand, yes, they're working hard, but if you make the effort to be nice and show that you really care and want to know, they will, and then, be appreciative, they will, I think they will reciprocate that. And I really, like I said, I really felt that it was only a 2-minute phone call every night, but to me, being back home 90 miles away, knowing it was going to be 4 more days before I could see them, that was the way that I was able to connect with them the most. It felt.
I think also in our situation, because I was there so much, and again, there's a lot of backstories that happened behind the scenes. I ended up living with complete strangers and moving into their house during our time in the NICU because they were willing to have me because I couldn't stand the thought of having to leave. And I know that there are parents who do have to leave, and gosh, I
Yes.
can't even imagine. I realize how blessed we were to be in our situation. But me being there every day, kind of a boots on the ground almost approach, I think. The nurses knew I was going to be there, and they knew, okay, well, we'll talk to mom about this. And additionally, our hospital had a family support group that met once a month or once a week. They would meet every week during the day, and then every other week or once a month, they had meetings in the evening for the parents who weren't able to get there in the day because they were working and things like that. And that was huge for us. And just, talking to the other moms who were there and other parents who were there. And it was a different experience, like I said, in a much larger hospital than when we, in our Houston hospital, we were 3 of 300 babies. When we came back to College Station, we were 2 of 4. So the very different vibe there.
Thank you. And I was going to extend a similar question to Shobana and Harish, where Harish, you made mention that sometimes, maybe I don't want to paraphrase it incorrectly, but maybe that you felt like you all were in the way as the medical team was trying to, or you were trying to stay out of the way. Were you made to feel like you were in the way, or what was that experience, and how did you connect with the teams?
No, actually, I may have over-interpreted and over-analyzed, I think, what we went through 14 years ago, right? If anything, I mean, I think, Dr. Vaisoli, Dr. Santiago, who basically run the NICU, or Dr. Vaisoli used to be part of the staff there, they and all the nurses, I mean, they were just fantastic. I mean, given that we were there for about 6.5 months in the NICU, I mean, we had about 87 nurses take care of our child over that period of time. And we were very fortunate that after a while, we got about 10 or 12 nurses who were regulars, that we just, they were our nurses, basically, right? And so I think we had gotten to a good, I mean, just like Eric mentioned, right? We'd gotten to a good relationship with them where they understood us, we understood how they worked, we trusted them, they trusted us. And so it was really a very good, productive relationship. Now, yeah, I mean, every now and then you'd get a nurse that was completely new to the baby, right? And to be fair to those nurses, there was so much of medical history there that you realistically could not expect them to know everything. Not just new nurses, but also new doctors, right? To where they would want to do things a certain way, and then we as parents who know the baby the best and who've known what seems to be working well over the last several months, we'd kind of step in and offer our input, if you will. And sometimes it would be well received, and at other times, I think the professionals felt like they knew better, right? But I think by and large, I mean, I think it was phenomenal for the way the folks at Plano Presby, which I think is now called Texas Health Resources Presby or something, right? They just took care of the whole family, really, right? And they were not just nurses and doctors, but in some sense, they were therapists to us, right? To the parents. I mean, I still remember days when I would basically be sitting there and just uncontrolled tears, right? I would just be crying. That's it. There's no way to stop it. I can't explain it even today, right? But I'd be crying, and the nurses would be gentle, right? And they would really appreciate what was going on and kind of give me the space, if you will, right? So yeah, no, completely appreciative. And look, every once in a while, you're going to get somebody who's not having a great day. I mean, that's just human nature.
Both sides. Mm-hmm.
Yeah.
Thank you. And I know we're just down to 3 more minutes. I wanted to ask Judith and Kate a question. I think there's one here in the chat that applies to both of you. And Kate, I know you were given very detailed instructions of what to do, and Judith, I know that you weren't, but even despite your instructions, Kate, and knowing exactly what to say when you came back, you did not receive the treatment that we would all hope you would have. So the question is what do you wish had been done in hindsight? What could we do differently? And I'd like to pose that to Judith first a little bit, because it sounds like you weren't given the same education, and it sounds like you had some concerns with your baby stay in the NICU. So it sounds like maybe communication wasn't optimal in your situation. And Judith, if you could tell us what we could do differently in the future.
Absolutely. Thank you for giving me the opportunity. Because someone or family or parent have been through a situation once does not mean that they have the intel and the detail on it all, because healthcare change. I'm in healthcare, and every minute there's new things that you learn. And what happened, my daughter 11 years ago is completely what's happening today. So we have to keep patients informed, even if we think they already know, maybe there's something that they missed. The NICU, on the NICU side, the NICU, whew, if the babies don't have to be there a minute over, let them go home. Don't hold them there for anything else. Treat them and let them go home, because it is bad enough that you carry a baby, you've been through the traumatic stage of having them or bringing them into this world. You got to the final point where you're still alive and your baby's still alive. You want to bring them home. We felt like we missed a whole entire month of his life that we tried to catch up, that we couldn't catch up. And another thing that I need to mention is the umbilical cord. I asked them to save it and they throw it away. So it's just the nourishing that we were supposed to get, we didn't get it.
I'm sorry to hear that. And then Kate, just in conclusion, I mean, you had all of the information and instructions, and I feel like the medical system still failed you. And we are, as you'll hear more about tomorrow, our project with the OB committee is really working on the recognition and response to hypertension in the emergency department, like after you've been discharged home. So if there's maybe a few words of wisdom of what do we need to take away from your story to make sure that doesn't happen again?
You know, I now tell my friends who are having babies, like, one thing specifically, and it's, you need to get specific instructions when you are discharged about, do you present to the ER and what to say to them, or do you go straight to labor and delivery if you're having a postpartum complication? It varies from hospital to hospital, and I have carried a lot of guilt for not just going straight to labor and delivery. And that is something that I will continue to work through, for probably a very long time. But I think my biggest kind of takeaway looking back at my ER experience was none of that would have happened if my husband could have been with me, because he could have advocated for me in a way that I was physically unable to do. And the COVID restrictions played a huge role in my experience. And I, as a healthcare provider in the oncology setting, I'm seeing that with my oncology patients. We're having worse patient outcomes. And that is across medicine. People need to have people with them to help them advocate.
Thank you all so much. Again, this was just a phenomenal time spent with you. Thank you so much for sharing your stories. I know we've all learned so much, and we will use these stories to do better in the future. And just thank you for sharing and for your courage and vulnerability. We really appreciate it. And now I'm going to turn it back over to our chair of TCHMB, Dr. Epps.